Welcome back to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving complex healthcare system. In today's episode, we welcome David Finkelstein to the Healthline. David is the Chief Information Officer at RiverSpring Living, which is a not-for-profit post-acute care provider based in Riverdale, New York. RiverSpring Living provides comprehensive services for older adults, including senior living residences for every level of care, cutting-edge rehabilitation, home care, and skilled nursing at the award-winning Hebrew Home at Riverdale. David is responsible for all technology news for this $200 million organization. David is also a proud Hofstra alum, having graduated from Hofstra in 1985 with a BBA in Business Computer Information Systems. David, welcome to the Healthline.
Thank you very much, Andrea. It's a pleasure to be here and looking forward to our conversation.
Awesome. Pleasure to have you here. I like to start every episode of our podcast by understanding everyone's origin story. Can you tell us a little more about yourself and what initially drew you to the field of information technology?
It was kind of an indirect route, not something that I had ever planned for, but got me here, and I'm very happy for it. Started my after high school college career as a pre-med student at the University of Rochester. And after the first semester or so, got disillusioned by back then late 70s, early 80s. Everything was very cutthroat. People were sabotaging chemistry labs to get ahead. People were committing suicide because they couldn't handle the stress. I was interested in science, interested in biology, but also was interested in technology. So I kind of switched my ways there, started taking classes at the University of Rochester on business and computers. Unfortunately, they didn't offer any undergraduate degrees in that area. So I spent 2 years learning whatever I can learn and then decided to transfer. So I came back to New York, living on Long Island, got a job in New York City working for a microfilm company and helping them in their accounting, and went to NYU for a year and tried to figure out what I wanted to do. The company sent me out to their Los Angeles office for a 1-week project, and that 1-week project turned into 9 months. And after that 9-month project, then they sent me up to Boston for another 3-month project. So I put school in hiatus for a little while and was enjoying working. Then when I came back home, decided that I wanted to finish, get my degree, and move on from there. So came back home to Long Island, went to Hofstra in nights and weekends, continued to work during the day, and finally got my bachelor's degree. After graduating, I was able to get a job at a computer software company that provided billing and medical record systems for the healthcare industry, and that's how I kind of bridged the gap between healthcare as well as technology, and really hasn't looked back since.
Can you tell us more about your organization, RiverSpring Living, and the work that you do there?
RiverSpring Living is a 110-year-old not-for-profit provider. We started in Harlem and moved up to our Bronx campus in the 1950s. And we provide all the different levels of care after you leave the hospital. We're most known for our post-acute care. So when you go to the hospital, for example, after maybe a knee replacement or a hip replacement, you'll come to RiverSpring in the Hebrew Home for 3 or 4 weeks of rehabilitation services where we give you an exercise program, we give you good food, we give you an atmosphere that lets you recover in order to return home to your home. We also offer assisted living and independent living when living by yourself is not appropriate or not needed any longer, and you're living with seniors your age. You have activities. We have a lot of technology that we've used to help make people that live with us really experience the best life that they possibly can.
Can you tell us more about that technology component, especially for assisted living? Can you go a little deeper into that area?
One of the first technology advances that we put in was really to help the residents that came in for these short-term rehabilitation and then wanted to go back home. Many people, after they have maybe a hip or a knee replacement or they have a broken bone from a fall and recover, they go back home because their home is not necessarily a safe environment. They may fall again or they may get injured and end up back in the hospital. So we created a safe discharge program where we give the family members a GoPro camera. They film inside the apartments or the houses where the residents live. We upload those to a virtual reality headset, and then we walk the resident through their own house and point out areas. Maybe we should move this area rug away from this coffee table, or the table is too close to the couch and it won't let you get up and down easier. So we've been able to reduce our number of rehospitalizations or injuries after discharge by using simple technologies like a GoPro camera and virtual reality headset.
That's amazing. And I understand you are doing other things in the area of the quality of care for the patient, enhancing that with technology as well.
We've enhanced our short-term rehabilitation, our physical therapy suite, with a number of pieces of technology. One called a Zero-G robot, and this is a ceiling-mounted robot that has AI capabilities built in. We put the resident in the harness, and the system will take up to 60% of their body weight off. So as they're recovering from maybe a knee or a hip replacement, we can ambulate or walk them down the hall with this robot and have them feel safer because they can't fall. They're supported in this harness, so the resident themselves and our therapist can push them faster and harder to recover without the risk of falling. We've also done a number of technology implementations up on the resident floors where the residents live. It used to be that the nurse came into the room and took blood pressure and pulse and temperature and respiration and wrote them down on a napkin and then typed them into the medical record system. We implemented a vital signs cart that will allow the work to be done instead of by the nurse but by an aide, and have all that information is collected automatically and transmitted to the medical record so that the record can trend and give to the doctors and the nurses reports on people maybe declining in a slow way that they don't notice from day to day, but we can see trends and we can learn that information. We also had a piece of technology suggested by one of our staff members. As you get older, your skin disintegrates a little bit. It's difficult to draw blood or to insert IV needles because the skin is very fragile and bruises very easily. We found a device called a vein finder where it used near-infrared technology to locate the difference in temperature between the veins and the arteries and the skin in the arm, and allows us to more easily insert IVs and take blood for residents without having to stick them multiple times, or maybe even send them to the hospital for a specialist to do this and keep them in the facility.
That's a great technology. I have very small veins, so I think providers that I go and see, that'll be helpful for them to use on me, I would imagine.
I've taken it a number of times to my doctor for doctor visits to help them out because I'm very difficult to get blood.
Oh, so it's something that patients could buy?
It's a $5,000 item, so not many people are buying them, but doctors should be able to buy them. And it's a portable unit, handheld, so we lend it out when we need to.
Okay, cool. It's good to know the price, too.
Yes.
With long-term care, a lot of people think about where would they like to age. And as you know, the trend now is for people to, they have the desire to age in place. Can you tell us more about the technology that's been assisting with that, with aging in place?
We look at residents that live with us, whether they're in short-term for the nursing home, whether in our assisted or independent living. This is their home, and we're trying to make it as much of a home-like experience as possible. So we have a very large, what we call therapeutic activities department that provides entertainment and activities to the residents on a day-to-day basis, whether it's using VR headsets to experience going to the Eiffel Tower, or maybe a neighborhood where you grew up or where you went on vacation. We also extend the virtual reality to exercise programs, so we have pedals and hand controllers, so you can, in your virtual reality headset, pedal through a boardwalk and shoot balloons so you can get some exercise while you're experiencing that. We have a couple of different entertainment robots. We have a Pepper robot, which is a 3-foot-tall kind of animatronic robot that's AI powered. So the robot can lead exercise classes, can tell jokes, can learn about the residents and ask questions about that. So that's another area that we use to really assist the residents. We have arts and crafts, we have movies, we have something called Drum Fit, which is even a simple low tech. We have very large exercise balls and drumsticks, and we just run some music and we let people just go have fun in the drums. We have wheelchair beach volleyball, so not even using technology. The goal is to entertain the residents and to really have the activity activities that are available so that they're not just sitting in their room or sitting at the end of the hall watching TV. This is where they live, and we should give them the activities that they deserve to live out their full life.
Sounds nice. I also understand that in addition to helping people age where they live, and also in terms of improving the quality of care that you provide, that you also implement various systems within the organization as well, correct?
We're an enterprise organization. We have back-end electronic medical record systems. We, matter of fact, just replaced our medical record system we had used for about 10 years. The system really wasn't meeting our needs, so we moved forward and implemented a new medical record system over the last 30, 60 days, and that has helped the staff in documenting, treating, and diagnosing residents better. We've implemented a new back office human resources, payroll, and scheduling system, which will allow staff to look at open shifts that they may want to bid for or put up their shift that maybe they have a conflict in their personal life that they want to be able to have someone else take over that shift, so they can do that without having to have staff members or managers approve that, and we can have that really moving to a more of a self-service model for our staff to be able to empower them to make their jobs a little bit easier.
Sounds great. I would imagine, since you're in the area, the field of technology, that it's important to you to keep on the pulse of what's going on in the latest advancements in the area, especially in long-term care. What technologies do you see emerging in long-term care that you think will be beneficial for an organization like yours?
Can't talk about anything without talking about AI.
Yeah.
So we've implemented a very interesting version of AI, not typical of what you've seen. We've implemented an AI voice chatbot for our residents. So it's an interactive system that the chat system makes a telephone call to the residents, same time every single day, maybe it's 7 days a week or 5 days a week, and just chats with them about anything they want to talk about. Has a memory, so it knows about some basic background about the residents, their family, their friends, their interests. So it will pick up conversations from previous days. They can talk about, how the family is doing. They can talk about the weather. I had a conversation once a few weeks ago of why they were harvesting helium-3 from the moon and what the benefits of that is. The chatbot has the technology of the entire internet behind it. It has also alerts that can help us. So if a resident is, let's say, complaining that their knee hurts them for a couple of days, it can send an alert to our medical director saying, let's check on that resident and see if we can help them with their knee. Or if they're complaining about the food, that it's too salty, we can send a notice to our food service manager. Let's check on them and see if we can put them on a different diet that will make them a little bit more comfortable. So we're trying to use the technology. We did a clinical trial at the end of 2024 with about 50 residents, and we showed a significant reduction in anxiety and depression, because people now, they think that they live in a congregate setting with hundreds of other residents, but a lot of them are isolated. A lot of them really don't have good friends to talk to. And just like you don't want to necessarily talk to your doctor, but you'll talk to a third party, people talk to these AI bots and they have really meaningful conversations. We're also looking at other technologies to help us in mining the data in our back-end systems. So we're looking through our medical records, for example, and predicting which is the resident that is most likely to decline and need some additional support, or which resident is someone that may need some additional medication or treatment based upon something that's changing subtly that may not be noticed by the staff, but something that AI can pick up in the pattern. So we're leaning on AI to be one of the game changers to help us in the near future to become more efficient and effective in what we do.
It's great that the clinical trial saw that reduced depression and anxiety for those patients because they had this chatbot to now chat with.
That study is going to be published in the Medical Directors Journal, I think, in March of this year.
Nice. Other areas where you see technology emerging that's going to be helpful with elder care in the future or long-term care in the future?
One of the other properties or businesses that we're started building right now is what's called a CCRC, or Continuing Care Retirement Community. It's very similar to an independent living, but it also wraps around an insurance plan so that if a resident's life can change over time, maybe they need to come into the nursing home for a few weeks for rehab and then go back to their independent apartment. We're building this building with kind of the high-end amenities that people in their 60s and 70s will expect. We're putting in a yoga studio, a Pilates studio, a jam session room, a golf simulator, a bar, a theater. So we're trying to really create the environment, the lifestyle that they're used to seeing outside of the organization, with the comforts of having a healthcare organization manage everything for them and having the healthcare services right down the hall from them.
Can I live there now?
You can. There's a few apartments left. There's 260 units. About 85, 90% have been pre-sold. There's an entry fee and then there's a monthly fee, but everyone is welcome.
Okay, sounds good. I got to figure out where to sign up and if I'm eligible just quite yet. Thinking about our students here at Hofstra or any student that may be listening, what advice would you give to students who are interested in working in the field of information technology, specifically also in the long-term care or the elder care area?
The latest statistics that I saw was that seniors are turning 65 in the quantity of over 10,000 per day in the United States. So this population is going to outnumber baby boomers, outnumber the young kids that are growing up right now. And the current people that are turning 65 have much more sophisticated needs and wants. So being able to understand this population, understand your parents and your grandparents and what they need, how they use technology, kind of their amenities are that they expect to have, and understanding it's not just hospitality, but that's an important part. It's not just healthcare, not just technology. It's kind of an intersection of all of them. So having the skills from all three areas is very helpful in being able to move forward and understanding that business. The number of jobs that are available is limitless, and the opportunities is really up to the imagination, especially using the new AI tools and all the technologies that are coming out in the marketplace.
So interesting. The younger generation, they fully embrace technology. When you were speaking, you were saying a lot about what you're providing to your patient population. A lot of them are elderly. Do you find that they are embracing the technology that you're giving to them really easily, or do they have any apprehension sometimes?
Like everybody, some people have challenges and other people very much embrace it. We have a very big intergenerational program here. We have teenagers and high school students come in to volunteer on a weekly basis and adopt a grandparent, for the lack of anything better. And they basically became relationships. They take them from walks. They help them with their technology. They just talk with them about what happened in 50, 70 years ago when they weren't around, so that the younger people will get empathy of what the seniors went through. And the seniors will get a little bit younger by hearing what's going on in the younger generation. We try to encourage that very much.
That's great that you're encouraging that intergenerational component to all that you're doing at RiverSpring. What's going to be on the horizon for RiverSpring when it comes to technology?
Talked about the CCRC, we're in the process of building. We're also going to be moving one of our nursing home buildings and renovate it and turn it into an assisted living building, because the need for skilled nursing is going down. The need for assisted living is going up. So we're looking at technologies that are in the marketplace. I'll be going to a conference called HIMSS in Las Vegas that showcases a lot of the new technologies. And we're trying to retrofit this building with the best aids and assistance and technologies that will help the seniors live the best life that they can.
Terrific. Well, thank you so much, David, for taking time to be on our podcast today. We really appreciate it. Your work is very interesting and very insightful, all that you share with us. So thank you once again. This wraps up another episode of The Healthline, Issues That Shape Our Well-Being. I'd like to thank our studio engineer, John Mullen, and I would like to thank our WRHU Radio Hofstra family for their help with the production of this podcast. Lastly, I would like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Ault-Brutus, and thank you for listening. Have a great day.